Good morning, my fellow Malaysians. This is Dr. K.N. Singh from JB again. We keep talking of the brain drain, and the government has sent numerous delegations to try and get qualified Malaysians to return and help the country. Recently, even Dato Anwar took a trip to New York to meet Malaysians and urge them to return. Few come, but are soon disillusioned by the cumbersome work endorsement procedures. The little Napoleon syndrome in our country and in the bureaucracy has put in so many impediments to what the Prime Minister is trying to do. This has caused much frustration and causes non citizen spouses to migrate back again overseas with their families rather than continue to struggle and secure stable employment and legal status to reside in Malaysia permanently and contribute to its development. Malaysian women are also unable to pass on their citizen right to their children if they are not born in Malaysia. This too is a significant factor hindering those who are willing to return to Malaysia. Without citizenship for their children, they face high cost of education, also health care with limited access to the basic services in Malaysia. Malaysia is currently home to 165,000 non-citizens who are married to Malaysians. According to recent figures compiled by the United Nations, there are 1.86 million Malaysian women living overseas. I had a Malaysian patient who I delivered and who went to study in Australia. She found a job there and married an Australian doctor, and she came in when she was 3 months pregnant to see me with the mother, as she is keen that her baby should be delivered by me. I agreed, and as it was early in her pregnancy, she decided to go back and stay with her husband who had a busy practice. She then developed complications and preeclampsia and could not travel back to deliver here, as she desperately wanted her children to be Malaysian citizens. She delivered in Australia, and currently children born by Malaysian women overseas are not allowed Malaysian citizenships, so she was forced to take Australian citizenship for her twins. My patient has been applying for Malaysian citizenship for her children since they were 1, and now they're almost 12 years old. In 2019, she moved back to Malaysia with her husband and her twins to set up home here, but her husband was unable to get a job due to bureaucratic hurdles with his registration. After 2 years, she had no choice but to move back to Australia, and she uprooted her family again and leave the country she called home. Wonder what her children thought. We lost a medical doctor and an accountant, both trained overseas with great potential to contribute, and who knows what her children may have contributed. One of them may have become a Nobel laureate, and that would have been our first Nobel Prize. This is just one of my many patients who I have delivered and who have been educated overseas. Most parents now tell them not to come back to Malaysia. The issue of brain drain is not just limited to those with high skill professionals who speak greener pastures, but to everyone else who wants to make a living. The Madini government needs to address this holistically and look at the issue from many angles. This includes tapping into the valuable resource of non-citizen spouses in Malaysia. No use sending delegations to ask Malaysia to return when we do not care about the talent that's already in this country. Remove the barriers of unequal citizenship rights. Immigration procedures need to be improved and streamlined. Employment policies need to be looked into. Gender equality and unequal pay for women must be addressed. Some of this may require constitutional amendments, and the lawmakers, as many of them are women, must take the bull by the horns and sort out these festering problems for women and confer equal pay and citizenship right to the children of these women that are born overseas. Some people tell me that the government cannot afford to increase the salary of women by 20.8%, which is actually the current disparity. Among the professionals, the disparity is just 14.1%. Perhaps if we cannot afford to increase the salary of women, we should consider lowering the salary of men to equal that of women. This may actually force some men to stop smoking and drinking as well. Many will be upset with my honesty, but almost half the Malaysian population of women will agree with me. This will also help the country as 50% of our salary bill will be reduced by 20%. Please feel free to write your comments no matter what you think, as you too are entitled to an opinion. Thank you for listening, my friends. Until we meet again, this is Dr. K.N. Singh from Johor Bahru.